MRI herpes simplex encephalitis. Herpes simplex encephalitis (HSE) is a serious and potential life-threatening condition characterized by inflammation of the brain caused by the herpes simplex virus (HSV). This condition is relatively rare, but it can be severe, primarily affected the temporal lobes of the brain. Causes: herpes simplex encephalitis is primarily caused by two strains of the herpes simplex virus, HSV1. This is the most common cause of herpes simplex encephalitis, and it is typically associated with cold sore around the mouth. However, when it infects the brain, it led to the encephalitis. HSV2, while commonly associated with genital herpes, it can also cause encephalitis, although it is less commonly for it to affect the brain compared to HSV1. The virus usually reaches the brain by traveling along nerve fibers such as olfactory nerves or spreading from an infection in another part of the body. In many cases, HSE arises when the virus reactivates from a latent state in a person who has previously been infected. Symptoms: the symptoms of herpes simplex encephalitis can develop quickly and early treated in critical for a better outcome. Symptoms can vary but typically include fever, a sudden fever that is not associated with a common illness, headache, severe headache that can be persistent. Neurological issues, this can include confusion, seizures, personality change, or hallucinations. Sensitivity to light, known as photophobia, stiff neck and back symptoms similar to those seen in meningitis. Altered consciousness is ranging from mild disorientation to profound coma. Now we come to diagnosis. Uh, in early and accurate diagnosis of herpes simplex encephalitis is critical for effective treatment. Diagnosis methods include lumbar puncture, we known as spinal tape. This procedure involves collecting CSF to detect a sign of inflammation and the presence of HSV DNA through the polymerase chain reaction PCR testing, which is highly sensitive and specific for HSV. Second is MRI. MRIs can show abnormalities in brain, particularly in the temporal lobe, which are commonly affected in HSC. EEG. This measures electrical activity in brain and can show specific pattern that suggest encephalitis. Blood tests. This can help rule out other causes of the symptom and assess the overall health and immune to the patient. Now come to the treatment. Treatment of herpes simplex encephalitis must be initiated quickly to reduce the risk of long-term neurological damage of death. Treatment typically includes antiviral medication, intravenous Lycovir is the standard treatment of herpes simplex encephalitis. This drug helps to reduce the activity of the virus but need to be administered as early as possible. Steroids, sometimes used to reduce brain swelling. Anticonvulsants to patient experiencing seizures. MRI appearance of herpes simplex encephalitis. In T1 weighted imaging, in the early stage of HSC, there may be slightly hypointensity or normal signal in affected areas. Later stage might show more pronounced hypointensity due to tissue destruction or necrosis. In T2 imaging and FLAIR imaging, these sequences show hyper intense signals in the area of inflammation and edema. FLAIR imaging is particularly sensitive to detecting changes in the white matter and cortical regions. Diffusion weighted imaging DWI and ADC shows hyperintensity signal in affected areas, indicating restricted diffusion due to cytotoxic edema. In ADC, area that appear hyperintense on DWI typically exhibit hypointensity and ADC maps confirming restricted effusion. In post contrast, T1 images may show meningeal enhancement after contrast administration due to inflammation, although significant parenchymal enhancement is uncommon. When present, it might indicate more severe inflammation and breakdown of the blood barrier.